If the virus wasn't 100% eliminated, it could start to grow back. Okay, and that could very well be what a rebound is, as opposed to the virus was completely eliminated and then it came back, which I suspect that's not what's happening here. I think that what is Paxlovid Rebound? Hey everybody, it's Dr. David here. Hope you all are doing well. So, I have been trying to understand more about Paxlovid in general and this rebound phenomenon that we're hearing about. Now, as with many things that are COVID related, things are almost like never cut and dry. But with President Biden having had this rebound phenomenon happen recently, I thought it would be a good time to do a little deeper dive and kind of see what we can find and talk about. Now, I did come across an opinion page on a website, MedPage Today. It's one of the sources that I look to for pretty reliable and balanced information. And this opinion piece actually had put together some of the things that I'd been thinking about and researching already. And so I appreciate this, and I am putting a link down in the comment section below in the description, in case you want to take an even deeper dive. Some of the research studies that I'll be referring to are mentioned there, that if you want to even look back to that original source data, of course it's there because we like to provide you with as much information as possible. Now, one of the things that you'll also see that they talk about there, which I'm going to get into more detail later, is to learn more about this. Of course, research needs to be done, and a randomized clinical trial, some people will call it a placebo type of trial, can very easily get to the bottom of this. And so hopefully that will happen. I'll talk more about that later. But a few things first. What is Paxlovid? For those who don't know, this is an oral antiviral medication. There are two actual ingredients. It's 3 pills done twice a day for 5 days. And there are two pills that are the actual antiviral. They stop the virus from replicating, it interferes with the genetic replication. The other medication that makes up the third pill for each of the doses makes the antiviral, the first one that I talked about, stick around longer so that it can do its job better. Okay. Now, what is rebound? Okay, because that's can be kind of a nebulous term, but there is an official statement from the CDC that describes it as a return of symptoms after getting better, or a new positive viral test after having tested negative, that occurs 2 to 8 days after the initial recovery. Okay. So, of course, that's two kind of different definitions all lumped into one. But of course, the overall sense of this is, did you get better and did you get worse again? Or did you get resolution and did you get worse again? So, but we know that if testing is being used as part of the criteria, well, COVID testing, while it's a tool that is helpful, it is certainly a crude tool. Okay. If there is a positive test, that means that the antigen, the spike protein, what they're checking for, is present in the nasal lining. It doesn't tell us whether the virus is alive or not. And of course, depending on how well a person does a swab, they could miss it. Okay, so it's a standard test that again we get some information about, but again, it's not like the ultimate answer when it comes to, does a person have COVID or not, or are they contagious or not. Now, again, how good of a sample does a person get? Some people kind of do a little this, some people kind of get up there. Although we know we don't need to do the brain tickling like we were doing a couple years ago when this first came out. Certainly, the quality of the swab is going to be helpful. So kind of rotating around more, playing more pressure on there, doing both sides, getting up there a little bit. That will help increase the yield to pick it up on that swab. Now, of course, it's also just measuring the spike protein itself. That's exactly what it's measuring for. But it is picking up spike protein, whether regardless of the type of variant that we're or subvariant that we're talking about. Um, so okay, now it is possible that after stopping Paxlovid, if the virus wasn't 100% eliminated, it could start to grow back. Okay, that could very well be what a rebound is, as opposed to the virus was completely eliminated and then it came back, which I suspect that's not what's happening here. I think that it probably got it mostly suppressed. So whether it's a person who got better 5 days into whether it's the medication or not, because if you look at the initial research that was done on Paxlovid comparing it to placebo, there was this rebound phenomenon happening with people who didn't get Paxlovid, who got the placebo. So this was more a matter of got better, got worse. Okay, but there's also some other explanations here. Now, first of all, um, regardless of whether a person decides to end their quarantine after 5 days of a positive test, or they do a swab after 5 days and it's negative, because of the fact that there is this uncertainty of when a person could be contagious, of course they should be wearing a mask, because we do know a mask, while not 100%, anything that's breathed into the surface of that mask is not going up into the air, and it does reduce the contagiousness of the person. May not be 100%, but it does reduce the contagiousness of it, and of course the quality of the mask will catch more. Um, Now, it is also common for many different viruses to have this waxing and waning, where the symptoms can get better and can get worse. This is not just for COVID. This was something that I personally have experienced on multiple occasions when I've had influenza, where I was getting better, and then a couple of days later, I'm like, oh my god, I'm getting these hot sweats again. I'm getting the brain on fire that I seem to get whenever I get influenza virus. And that happened for me for weeks off and on after catching influenza. So of course there could be these signs of symptoms, but I don't think I was contagious during that time period, but they did come back. Um, so if you test and it's negative, does that mean that it was gone, or were you kind of in a waxing or waning, and maybe it could even be coming back? And again, we just don't know. Now, some people will say that they're having rebound just because they got sick again. Okay, and they don't necessarily test the end, and then they'll just still declare it's a rebound. Now, again, it could have been the same virus that didn't get completely eliminated, but it could have been another virus that you just weren't unfortunate enough to pick up. So if you're going just by symptoms, it may not have truly been a rebound. We know a couple of things. The first couple of weeks after a virus, a person's white blood cell count goes down. So they're more susceptible to picking up another virus during those first couple of weeks. That's the reason why I encourage people to continue the immune support protocol for 2 weeks afterwards. In all honesty, why I recommend that if a child is due for a vaccine, to maybe even wait a couple of weeks after that infection to let the white blood cell count come back up before considering giving a vaccine. And this is for any childhood vaccine. This isn't just from talking about for COVID vaccine, but if they're trying to keep up with the school schedule, etc. I like to give a little bit of a recovery period before doing something that's asking the immune system to react in a proper way. But also, we know over the 2 years, and of course, different parts of the country, here in Florida, there's been more mingling that's happened in the past year. But in other parts of the country, people have still been very strict, whether it's with masks and not going into public places, etc. But regardless, when people are not around other people mingling, they're not sharing the germs. Right? Which, of course, yes, I guess we could all live in a plastic bubble, but that is not reality. But normally, over the course of a year, over the course of several years, we're exposed to lots of different viruses, but it's kind of being spread out through amongst the population. But if nobody, or a very small percentage of people, have been exposed to a given virus and then it starts coming around, it's going to spread through a lot more people as well. So again, that could certainly lead to the more likelihood of a person picking up a second virus, just because of the fact that mingling is happening more. But you know what? There's other things that can cause these type of symptoms. Maybe a person is having an allergies to something. Oh, they didn't think about it, but hey, that could be a symptom. Then they'll call that a rebound as well. So lots of explanations for this, and does that really mean that every single case of rebound or that's reported about, talked about, is a rebound? Maybe not so much. Now, there is a dearth of information about this rebound phenomenon in the first place. And the research that's been done, most of it was done before Omicron. So, of course, it's fair to say, hey, different variant, maybe there's a different level of rebounding that can happen with one variant versus the other. And of course, that's a reasonable explanation. But the review of the studies that are available, as I mentioned, is in that document that we're linking to in the comment section in the description down below. But there is now research that is going on during this time that is taking into the Omicron variants, which is great. It is not clear from what we can tell at this point, though, as to how much they're looking at rebound here. Okay, but what can be done? All right. A very basic double-blinded placebo-controlled clinical trial could be set up. There are thousands of people catching COVID every single day. And of course, not everybody's testing being positive. Enough people are being positive tested that we're still seeing tens of thousands of positive cases. So the subject size, the sample size is huge, and we could do this so easily. We could do by splitting up into half the people will get Paxlovid, half of the people don't get Paxlovid. Okay, we can look to and separate up between people who were vaccinated and people who are not vaccinated. People who had documented previous COVID infection, right? Because that would all take it should be taken into account when trying to understand what a person's potential risk factor is for the rebound, but also what does Paxlovid work for that individual in the first place. Now, in addition to that, um, we're also potentially able to not potentially, we can totally look at a symptom tracker where every day the person fills out a standardized form for, have you had this symptom, have you had that symptom, have you had this symptom, how are you feeling overall today, any fatigue, and that can be asked during, and all they have to do is record this for about 3 weeks, because if there's going to be a rebound, it's going to happen before that. And so they can ask all the type of question. We could collect so much data so quickly. So, and of course, that the implication that can have in terms of what to do going forward. So, CDC, medical universities, rich people who have foundations, get to work. This can be figured out so quickly, and we deserve to have the information. There has been such a paltry amount of information, from the vaccines working from different strains to all of this other stuff that we don't know. How protected are people, who have had the disease already? It is shameful that we do not have more information at this level. But this particular issue, because it's so easy to capture these people because they test positive, get them in the protocol, that we can get this done so fast. So let's see if people respond to it. Obviously don't have so much faith in it, but it could be easily done. So maybe people can get off their butts and do it. Have a nice day. You like what you saw? Watch another one. Click right here.